Go.
Great.
All right. Well, hello. Chelsea, are folks that are not panelists joined but not on camera?
Yes.
Fantastic. Well, welcome then to our early childhood data roadmap work group. I feel like I'm a flight attendant, so if that is what you were expecting, then you're in the right place. It is 3:34 on September 20th. So I'm Sarah Abrahams. I serve as the Deputy Chief Officer for Prevention and Early Intervention at DFPS, and also the chair of this work group, or co-chair really. So welcome to folks, members of our work group and members of the public that are joining us. We're producing this meeting as a Zoom webinar, and council members, presenters, and agency staff are participating as panelists, and are some of us on camera unless otherwise indicated, or COVID recovering. And then Chelsea Moore is our early childhood data policy analyst at TWC, the Texas Workforce Commission, and she will serve as our facilitator today. Please remember to state your name before you speak. And we have, as always, asked for public comment. The opportunity to submit written public comments closed yesterday at 5, but you can still request to provide oral public comments today. And you do that by emailing your request to Megan Schneider, and her email address is on the slide here. And I think those are our logistics. For members of our work group. Oh, are we calling to order? I'm going to ask a point of clarification. Can we do our roll call and the minutes at the same time? That's what we're doing?
Yes.
Okay, fantastic. So in the invitation to our work group members, you should have the draft August 2022 meeting minutes, either in your email or attached to the calendar invitation. They're fairly high level and non-controversial, and just an outline of what we chatted about. So if you have not had a chance to take a look at them, go ahead and do that. And then I'd like to request a motion to approve the August meeting minutes.
And I can call roll as well. But
great.
Sorry, go ahead.
No. Unless anyone has any edits or changes that they want to highlight. All right, hearing none. Chelsea, all you.
Great. So when I call your name, please reply for, against, or abstain. Sarah Abrahams.
For.
Weldon Beard. April Crawford.
For.
Travis Duke.
For.
David Fagan. Kim Coffrin.
For.
Tori Lee. Kirsten Swab. Laura Varnell. And Allison Wilson.
For.
Great. So the motion to approve the August 2022 meeting minutes is carried. And I'll pass it back to you.
Fantastic. So here's what we're going to talk about in our time together this afternoon. We're going to walk through the stakeholder engagement process and updates. We're going to look at the roadmap draft and talk through some places where we may need some help fleshing out some additional information, or just making sure that we're pulling the right information from you guys as panelists, and from identifying where we might get some of the additional information we'd like to include. And we're going to talk a little bit about timeline and next steps, especially as this work group begins to kind of overlap a bit with our broader Texas Early Learning Council work. And we'll take public comments if there are any, and talk about our next meeting. So with that, let's take a look at our stakeholder preliminary results. So as you guys know, we really have two well, we have several ways of collecting stakeholder feedback about this roadmap that we are developing. And two of the ways that are in motion right now are the survey that we're sending out, and then these and our listening sessions. So the survey preliminary results really highlight. So these are our preliminary results that we've gotten about 65 survey responses. Most folks are saying that they're currently integrating data in some way. And many of the folks who are not want to, or are thinking about it, or are in some frame. So this is something in motion. There's some energy around that. About half of the respondents provided responses to the open-ended questions about how they would use data. And the next step is really to dive more deeply into that and see where there may be trends or ways that we can begin to use that, or highlight some of those responses as part of our use case scenarios in our roadmap itself. I think, is there anything else to note about the survey preliminary results? I mean, they're really very preliminary, and we need a minute, I think, to dive in. And I think, Chelsea, that's what we'll bring potentially along with the sort of summarized stakeholder listening session results together to our next meeting. Can you remind me when the closing date was for this initial survey?
Sure. So we asked them to respond by last Friday, but we did have a listening session last night. So we left it open in case that last listening session would like to respond to the survey as well. And I think it's up to the group if we want to go ahead and close it, or are we happy with 65 respondents, or do we want to do one more push, or it's up to you all.
What do you guys think?
I think if you just had the last session, after a couple of days, it seems like you could close it, because we launch it again in a couple of months, right? Or
Yes, correct.
I agree.
Yeah, that seems
Okay.
fine to me too. Okay, so let's talk about the listening sessions then. So this is, so far we've done 8 over the last 5 weeks. This is sort of an overview of who came and when they were. I will say, because the last one was last night, we haven't had a chance to really cull through all the notes and identify all the trends, but I do know that in each of these listening sessions, at least one of the members of this work group were participating, and there may have been other folks taking notes or sort of writing comments down from your organizations. And so if that was you, or if there were folks on your staff that were there as note takers and you haven't already sent those notes to Chelsea, if you would please do that by the end of this week so that she can begin summarizing and curating all that information for us to look at together, that would be really helpful. Anything for those, any reflections? Oh, is that the next, is reflections on our next slide? Am I getting ahead of myself?
I think this one, if anybody wants to speak specifically about their session and give any highlights, I think this would be a good time. And then we will have some general reflections and discussion in the next slide.
Okay.
Chelsea, did Brittany send you the chat from last night?
She did.
You have that already? Okay. I will, I'll type up my notes and then send those to you as well. But the chat box really had the majority of the feedback from last night. The parents like to chat.
The session I did alone with our project directors, there really wasn't any feedback to provide. They were very, very quiet. I had to do a lot of explaining about the whole idea and everything. But the one that Tori and I did together, there was a lot of discussion. And I think, Chelsea, you guys took notes for that, right?
Yes, and I believe it was recorded as well.
Yeah.
Chelsea, I just sent you the notes from the research listening session. It was really fun. We had a great group from a really great sort of variety of research institutions in
great.
the state. So it was really a great group. They definitely offered to assist us further as, you know, we get further into this work. And if the agencies want some support around this development, they were clearly on board for helping in any way that they can. I can share like their highlights if you want, if this is, it's all in notes, but if you want me to share out a few of the highlights, I can.
Yeah, that would be great.
Sure.
Do it now. Is it good?
Sure.
I don't know how much time we have for this.
Yeah,
Um,
we have
so-
time.
Okay, so I kind of pulled like some key themes from their comments. A big one for them is for our first policy questions, backing up and considering you know, vital statistics kind of information and census level information. That without that, right now it's framed very much as just those Texas sources that we have listed, but integration of either sort of census data or vital statistics would sort of change the game in terms of what you could do with it.
Can you say more about that, April? Like, what is,
Mhm.
you mean like mostly demographic information? Is that what they're
Yeah.
thinking?
Yeah, more demographic information. It would allow you to get to location, which was a recurring theme. It came up in multiple sort of portions of the listening session. That location level information is really pretty critical if you want to, especially if you want to embed any kind of an equity focus, that being able to back up and have location information that you can get either from like census level tracked information would be helpful. They talked a bit about, and I don't think I might not be able to find it quickly enough, but basically some of the shortcut definitions that we use to look at things like poverty or risk in a community, that sometimes what we have to rely on, like let's say maybe free and reduced price lunch, is actually not a very robust indicator. So having, you know, sort of redefining what we're able to use at that level, and census could provide some of that. The birth records were really those that kept coming up. And I know there are probably some challenges because not all of these kids are born in Texas that are in Texas. But
Right.
there was a fair amount of good conversation about the need for more vital statistics. Another theme that was really strong is the need for individual level identifiers. You know, even if the children are not identified, that there are a lot of these questions like, is this program working for these types of children, that we'll just never be able to fully answer if the data set is so aggregated that you can't, you know, sort of understand what's happening at the child level.
Yeah.
Another one, and right now, yeah, so another one that came up a number of times was this location idea. And, you know, I've got a lot of notes in here about that, but I think location's a big one. See, another one is-
Location, like where kids are located, is that, I mean, like where they
kids
are?
Yeah. So you're actually able to say, you know, it's sort of like a precursor, like when we see work around things like childcare deserts, or, you know, it's about starting to get even more and more local in our understanding about how kids are doing and where services are and aren't being delivered. So location was a major theme, and they gave a lot of nice feedback that's in the notes about how that could sort of be a game changer. Another one is they thought we should go through an exercise of mapping the existing data to the policy questions, just to sort of highlight where we already probably have good sources of information and where we clearly, you know, don't. And that could sort of lead to thinking around kind of a scaling plan for here's what can be done, here's what can be answered in a phase one, here's what would need to happen if we wanted to bring on new data collection, you know, that you would sort of be able to kind of map it out and think about growing into a set of indicators and data that actually let you address all of the policy questions. But their assumption is that we don't have all of it now.
That's really interesting. And I think it's a really interesting idea to sort of be able to articulate what of the things, what of our business cases or our use cases could we answer
Yeah.
with our existing data sources, and what would require new data collection? I think that is a really big question for us here, because I do think that there are some places where either we're just not collecting the data, or we're not collecting it in a way that you would be able to disaggregate it or connect it, April,
Yeah.
in the way that you're suggesting. So I do think that will be helpful as we think about what a phased approach might look like.
Yeah. And that's part of, like, you know, by aligning those questions, by kind of having that framework of design, delivery, receipt, and response, what you're kind of doing is saying, okay, to really about, you know, if you want to answer these types of questions about effectiveness and outcomes for any particular program, you'll need data elements in all 4 of those kind of buckets. And it would be really interesting use case wise to say, okay, where do we already have coverage across the buckets within any one program or service line? And it is just a good way to do kind of gap analysis. And then you can say, here's what's ready to go, phase 1. Here's, you know, like a next set of priorities for new data that's feasible to collect or link, but just hasn't been yet. And then here are a set of, you know, indicators and use cases that are, you know, further out in the future because no agency collects this information today.
Yeah, I mean, I'll say in our conversation, there is still a lot of questions and concerns about identified data and privacy issues, and how to articulate a response to that, how to be clear about who has access to what kinds of information, and when it would be sort of de-identified and when it would be aggregated, and how does that, what's the different, like, how does a layperson explain the difference between those things, and how do we
Yes.
address concerns related to that? And it
Mhm.
made me really think that in our roadmap, we probably need to have some section that really at least discusses it. Like, maybe we don't have all the solutions, but we need to at least be able to outline what that means, what those things mean as we think about considering them, because I don't think we're going to get very far with these ideas. And even no matter how compelling the business case is, if we can't explain the protections, the privacy protections around this data, I just feel like we're sort of pushing a boulder uphill. And
Yeah.
so I think that will be a very important part of our roadmap.
I think that came through loud and clear
Yeah.
in the listening session.
I would be surprised if it wasn't at least addressed in every listening session. I mean, it really is. And we just need to be able to explain when that's, and, you know, what's what the different terms mean, which of this data can be identified or de-identified in that way. And then what some potentially even what some options would be for, I mean, to your point, April, I think part of the research challenge is that if you aggregate it so much, then you can't, if no one has the identifying data, then you can't really track, are these things working? Because you don't have a way of following a kid or a family to an outcome. But not everyone has to see that level of data. And often we're working with researchers where a small group of vetted folks have access to the identified data, or they have access to parts of it, in the way that it's combined at the end means no one person has had their eyeballs on all the different parts of the data, but combined, we've been able to get to this result. And I just think if we can explain what some of those options might be and protections might be, I think it will be helpful in our use case.
I think so. And I think, and I might have said this funny. So I think the ideal for a lot of researchers who want to work with something that's more disaggregated than what's typically available, they wouldn't necessarily want to identify or know who the individuals are. They're looking for de-identified person level information. So you would know at an individual level that this is an individual.
Person A.
This is a
This is
person A.
person A, and
Yeah.
that's the same as this person A, but not Sue
But
Jones.
not who, yes.
Right.
Yeah, that's kind of what they're, so I think at minimum, what we got to by the end, it's this normal, it's this typical conversation we have when we're talking about whether or not we can have person level kind of information versus aggregate, where it's like, everybody initially is like, oh, we've got to have the individual. And then there's like, oh, but I guess there are a set of questions that we could address with something less than that level of information. So I do think, like, to your point, I think the roadmap should just be really transparent about, here are the levels and we're only going this far. The state is
Yeah.
proposing to go this far.
I really like that, of like having kind of a continuum of the way that data, of like how transparent data might be on an individual level, and sort of creating kind of a visual from like, I can see all your personal information to I can see no de-aggregated, everything is aggregated and I have no, it's all grouped in this way. Like, there, to show that continuum, I think really helps. And even I think I'm nervous. I mean, even just defining what person, say that term again.
I don't know if it's a real term, it's like person level, like all
Person
the way
level.
down to like, I'm not just part of a group. This is a person, participant A, subject A, individual A.
But I
and
even
had
think
these
that
experiences.
term person level could, unless you had a definition that said person level, but not identified person.
Yeah.
Just,
Yeah, you're still de-identified.
so I
and it
just think
means
that's the
sweeping
kind of
out.
example.
Yeah,
Mhm.
and it also, there's some complexity with it, because then in order to protect people's privacy and their information, you have to remove anybody who has something, is in a situation that's so rare or
Right.
infrequent that there's really no way to present them in a de-identified way.
And we run into that issue with our data every now and then, like when someone will ask for specific, say, service
Mhm.
data by county. And we get to a county that has so few people that receive
Yes.
that service,
Mhm.
Yeah.
we can't provide the information.
Yeah.
Right.
Yeah, you would
have to
definitely have
mask it.
to, you'd have to find ways to set those thresholds so you don't ever.
Well, in April, as you guys were in the weeds with your researchers, we met with the parents last night, and their take on data was really enlightening. We talked a lot about access to data and access from parents' perspective, and where do they get their services. And so there it was like, we need the data of like where these services are and how do we find these services, and where where's like we want to use that data to be able to actually get services for our kids.
Mhm.
And then the other thing, when asking about how would they use the data information, and one parent was like, I want to see myself in the data. I want to be able to say, this is me and my family, and I'm not alone with my child with, their specific needs. That was kind of an aha moment from the parent perspective of wanting to really understand, how many children with special needs are really in the state, and where is that group, and where are those services. And so it was just very interesting in that sense.
Any other comments or reflections? I think we miss, Chelsea, our reflection slide, so maybe we can pull that up next. We just jumped right in. So these were the questions we were gonna ask if it didn't just happen organically. If there were any general reflections, if there was any specific feedback on the policy questions, or in examples or suggestions for our use cases. So if there's anything you guys want to add,
Just so the rest of the group knows, Kirsten and I met with Chelsea, I think Megan, were you there too, to kind of reframe those questions to be more parent friendly.
great.
When you looked at our general questions, they were very inside baseball funky.
Yeah.
So we rearranged them, and Chelsea has all those questions. So as you guys compile that data, you can see how we kind of reframe them to make them more parent friendly and useful versus those of us that really want the data for other purposes.
The research group, they really thought we needed to add a policy question that specifically addresses equity and positive outcomes for sort of which groups of children, or that was, that was the most specific feedback they provided about reframing of the questions. They also said that they suggested that we do more to define some of the terms that are in our policy questions, like defining what succeed means, defining what on track would mean.
Yep, those
So
are,
these definitions mattered to them.
oh, go ahead.
I was going to say, we asked the question about what does quality mean? What's the like, what, as parents, how would you define quality? And most of them really kind of circled around staff and the need for consistent, well-paid staff. I think that really stretched everything from the ECE providers to the ECI providers. It was not just childcare staff, it was therapy sessions and just the real need for that was staffing is one of the ways they deemed quality, and making sure that they don't turn over, because when they turn over, then children and families relationships and trust has to start all over again.
Yeah.
Which makes sense.
Did you guys, I just want to ask again about this last question, which is like which programs and services should be included in our foundational policy questions or use cases? And I heard Kim say that from the parents' perspective, one of the things that was most important to them was like, what are the programs and where are they and how can I have access to them? So for sure, and that makes total sense to me from a parent perspective. Did we hear from some of the other stakeholder groups or sort of professional groups what they thought would be sort of the most critical question, sort of the why behind it, or how they might use this data, or sort of what they would hope that they would be able to look at or track?
From the ECE advocacy, and Chelsea helped me because I don't have those notes in front of me. I think it was this, this having statewide data, but that they can drill down to the local level then to make local decisions. So if that's, in the childcare space, that way local workforce boards can actually know how many kids are on the waiting list and their gap is here, and like where those services are. Or a community, city or county could look at those numbers and say, oh, let's influx some city or county money to make up to make up where the need is that the state or the feds aren't providing. So it's those type of services of how do we use those, like where are the children, where are the families, and then where are the providers, and how can we match those ultimately to serve more children and families.
Yeah.
I think, Kim, to build on that, the group I was with, the research group, they really emphasized, like, if we had everything you just said, that they want just to know about the population that is participating in particular programs, they also need good access to information about the children in the population that don't participate. I think some of that is implied in our foundation policy question.
Yeah.
But basically, to construct any kind of matched comparison groups, if you really want to look at outcomes for kids who participate versus did not participate, but have similar characteristics or needs, you really need to make sure that the data system includes comparison.
Right. I mean, taking the childcare numbers, for example, we're serving, I think, 14% of our eligible kids with our CCDBG dollars through childcare subsidy. So where are the other don't make me do math. 85%. 85%. Like obviously we don't have the funding for them, but are they getting, where are those children? Like, and where can we, if we got more money, that was a great sentence. If we, it's been a long 2 weeks. It's only Tuesday. If we did have more money to spend on eligible families, how do we find them and how do we get them into the systems? And then where is the kink in the system to make that system flow more smoothly? So families are applying, but there's a wait list or their application stuck. Is that, where does that kink exist? Is that in the application? Is that in the intake? Like, where is that piece of the things?
Well, and part of that is really understanding, like, what is the gap and why is there a gap? Like,
Right.
many of these services are voluntary.
Right.
So is the gap because there's not access or because parents are choosing not?
Other
to?
options, right?
Right. And we just don't know the answer to that because we don't really know. We aren't able right now to distinguish between those in that way. So that is a really
Exactly.
interesting sort of use case for this is understanding that is it an access issue or a choice issue?
Mm-hmm.
It's interesting. I don't think, Sarah, that either of the groups I was in, I don't think the questions really, at least the way I asked them, they didn't really elicit feedback on like which programs or, sort of service lines or,
Yeah.
it really didn't, I didn't really end up eliciting anything about that when I'm looking back through the notes.
Yeah.
How will you all decide in the roadmap which services or population?
How will we decide?
How
April?
will we decide what the use cases are focused on?
You get a program and you get a program.
I mean, I think some of it will depend on what the questions are that we want to ask and where the where information is currently. I mean, that's part of looking at it all together is kind of figuring out these phases and where do we start? So yeah, I don't know that we have the answer to that right now, but that's, I think, part of what we hope to look at.
I think different groups are going to look at it and have different goals and want different things in it, so
Yeah.
it's just going to be interesting once we get farther along and we have to make those decisions. Okay, we can please these guys, but not these guys, but that kind of thing. So
Yeah, and like what's doable and what can we afford and all the things.
Well, and then also, like April was saying earlier, is there a phase 1, phase 2? Like, what's the low hanging fruit? What's the slightly out of reach, but we can get there, and then what's the ones that are very top of the tree and
Yeah,
will be a bigger stretch that we still want to get to, but as time, money, and resources allow.
Yeah. Anything else on the listening sessions? I mean, I think the next step will be to like pull it all together and sort of create some summaries. We'll include the summaries of that in the roadmap. And then if in our next meeting, if there's anything, any sort of burning trends that come once we look at all the notes together that we haven't talked about here, we can certainly highlight that when we come back together next. Okay, well, let's talk a little bit about the actual roadmap, which is kind of our group's deliverable. So this is sort of our table of contents, essentially, for this roadmap. Sort of just a high-level overview, introductions, what is an ESIDS at the beginning, what is the early childhood program landscape and data landscape look like in Texas, what have we sort of done to prepare? What are some of the lessons learned from other states, which we've already sort of started to pull together? That's part of what got us here in the first place. And then sort of a timeline. So this is maybe where we might highlight some of that phased approach that we were just talking about, or that Kim kind of highlighted. And I know that we here say like short and midterm planning, but Kim, I really like the way you outlined sort of the 3 potential phases, like what can we do right now with what we've got, what's going to take a little work, but we think we can get there, and then what's going to really require a much deeper investment. So I like breaking it up in that way, in the way that you outlined it. And then finally, the recommendations and considerations for next steps, which really will include our recommended use cases or the kinds of policy questions that we think we could answer if we had a more integrated approach that we can't answer now, and sort of explaining why that would be helpful and how we think that would improve services and outcomes. So, and we're really using these surveys and the stakeholder engagement to figure out kind of how to answer these questions. What are folks most interested in? Where does the data already exist? How are folks already integrating data? In some cases, there are examples of ways that two agencies might be working together to integrate data in one way. And if we just added one or two more agencies or programs, we could actually have a much richer story. But because two of our agencies maybe have already started the path, it's really more in the phase 1 or 2 because some of the initial work has been completed. So I think those are some of the kinds of things that we can highlight in this section of the roadmap. So what we have for us to look at today is like the intro part. So really what is it and what do things look like now in Texas, and what are our existing data, like that example, what are the existing ways that we're integrating data or that we're already starting on this road that we've identified collectively that could maybe be a stepping stone for something more complex or more holistic. And Chelsea, do folks have this in their emails, or we're just going to look at it together and they'll get it in their email later?
It should be in your email and attached to the meeting invite, and then I can also pull it up.
We'll do all the things. So in whatever way it makes sense for you to look at the roadmap with us, whether you want to pull it up on your screen or look at it on this screen, that's what we're going to move towards now. So I will just say, as Chelsea is pulling it up, or as you're pulling it up, that Howard Morrison from the PDG Beta 5 Technical Assistance Center, who we've met with, and it has helped us identify some of the other states that we've pulled learnings from. He really has worked to help us draft some of these initial sessions. Please feel free to provide feedback on those. The first three sessions, the first three sections are really more of the narrative part. I think all of this are things that we've seen before, but now that you see it all together, if you have any feedback on that, of course, we'll take it, and we could take it today, or really please feel free to email me or Chelsea or Megan with any comments that you have. But we're really going to dive in today to the outline of the last section, which is the data initiatives that can support ECID's development. So there are a few subsections on that, and really what we want to do here in the next like 20 minutes or so is kind of pull out for the 4 subsections, which are prior and current data initiatives, current data governance structure, any existing statutory requirements around data, and budget or funding supports for this kind of integrated data. We sort of want to try to show what we think we've captured so far, and then what we're missing as a part of our drafting of this. So do you want to dive into the first part, which is the data initiatives? So this is really essentially the question here is, we're trying to list existing data integration or data matching or data sharing initiatives that are happening in the early childhood space. These were the ones that either have come up in conversations, or that we knew about, or that have been highlighted either in a strategic plan or some other document that Chelsea and Megan combed through. And so we're really just trying to see, what have we missed here? So the Ready Communities, Ready Schools, Ready Students, the Texas R3 the data dashboards, the eSig data dashboards, which are, I just want to make sure that I'm clear. These are the ones that are connected to our results-based accountability work. Is that, are these the PEI data dashboards, or sort of PEI funded data dashboards?
So this was before my time, but I believe so. I think it was DFPS funded,
Yes.
the group
Yes.
in the dashboards. Yes. Okay. Thank you, Allison.
So then I might, in my mind, and I'm jumping ahead because I know a little bit about this, but so the early childhood systems integration group data dashboards are sort of the state level version, and the PEI results-based accountability, in my mind, those are our local coalition versions. So in many cases, the questions are the same, and in some cases the data is the same. It's just not at a state level, it's at a local level. But we have probably 10 to 12 local communities that are using a version of this integrated data dashboard at the local level. And then we have sort of a version, a very high level version at the state level. That's when we started doing this ESIDS work, kind of got put on the back, like sort of paused that work. But I think those two are related enough that they should go in the same bullet. Then the top. Oh, go ahead.
Sorry, I was also wondering if some of these I'm very familiar with. Some of them I'm like, I don't know what that is. Is it would it be, because it's just not in my lane, will this get flushed out to kind of explain what each of those are as well, and like where those live and where that data is and what it collects?
I think that's a good idea. And so, yes, I think we probably need to do that, even if it's just like a couple of sentences explaining what it is, and if it's publicly available, where to find it.
Right. Yeah.
Are there any that you guys know about that we're missing?
There's a project that ECI has been participating in for about over a year and a half or two. It was pre-pandemic, so I guess 3 or 4 years at this point, with Rice University. And I can't remember what they're calling it. I'm not on that. I'm not really involved in it, but I can talk to Naran, our data manager.
That'd be great.
And have her and share this document with her and see if, because she's our primary contact with those guys. We have a contract with them in a data sharing agreement and all kinds of stuff. And I believe they're looking at ECI data and at least Medicaid data, and they're connecting it. So
Is that the Texas Policy Lab?
yes, that's what it is. Yes.
Yeah, Christina from that team referenced some of that data in our listening session.
And then, go ahead.
And this is really not something I know anything about, so just redirect me. But the Texas demographer, I don't know a lot about the Texas Demographic Center, but that's a state appointed role that manages population data for Texas, right?
But isn't it over at DSHS?
I'm trying to find out, and I can't quite.
They're at UTSA.
UTSA.
State demographer is out of UTSA.
Because it looks like they have the kinds of sort of background characteristic data sets and location types of data sets that I really do think would make this, even more exciting for people to be able to use, and they'd be able to drill down and answer even more questions. So I don't know if there's a way to think of that data as being in scope.
DSHS, I think this is what I was thinking, that DSHS does have a really large data center. I'm not sure, I can't think of their name off the top of my head. I have a couple of friends who work there, but they might be, we turn to them often for questions.
And
I can't remember what they're called.
And I will say, and I don't know if this is something that we want to list here, but it seems like, even though it may not be as formal, that, for example, PEI has several MOUs or sort of data agreements. And an example is one with DSHS that allows us to match some of our data in order to identify, you know, sort of birth outcomes, for example, for families that may have received one of our services or something that where the intention is improving some kind of birth outcome or breastfeeding or usually it's something that would be on the birth certificate. So birth weight or tobacco cessation or something like that. And so we have an agreement around how that's now. I don't know all the specific details of exactly how that looks, but I do know that those kinds of MOUs and data sharing agreements exist, not just between DSHS and PEI for that one specific project, but I would guess that those kinds of agreements exist between agencies. And so I wonder if there's a way to inventory that.
Mhm.
And that would probably just be like, we would have to go to each of our agencies and sort of say, what are these projects, or where are these MOUs or formal agreements that exist, and like, what's the purpose and the scope of them?
Mhm. Yeah, that seems like it'd be informative to look across all of those. The only other one that I didn't, and again, I really don't know very much at all about this, is we have a couple of researchers in one of these groups that are part of education research centers, ERCs, where it sounds like they already, sounds like there are 3 of them in the state, and they have like a deeper level of access to some integrated data sets across agencies that are probably it sounds like there are identifiers, and then they're able to sort of respond to requests for data where these data are put together. So I don't know if there's anything around kind of the infrastructure for how those arrangements were sort of built. I don't know if any of that would be informative here.
And the name of the group at DSHS I was trying to think of is the Center for Health Statistics.
Mhm.
Yeah.
All right. This is very helpful, I think. So let's just in the spirit of time, let's move on to data governance. So this is really the question here, and it's quite sparse right now, is really like, what are the existing systems or governing bodies or councils or sort of agency decision-making bodies around data that exist now?
And Sarah, this is more of a question than it's just a question. I don't know the answer. Where does the general counsel for each state agency fill into this? Because I know like what's allowed with one general counsel may not be allowed with another state agency general counsel, and we know other states are sharing data across agencies, but yet we seem to have these big roadblocks with the general counsels. So just like, how do we bring them into that conversation? Or is that in the implementation stage? But it's definitely a roadblock in making sure that this is all doable.
Yeah, I agree. I mean, I think every agency has their own DUA template that they use. I know ours changes all the time. Every few years.
DUA?
Data use agreement.
Got
Yeah,
it.
so, and which is usually a part of every contract that where there's client data moving around. So that's a good point. So I think it is not going to be, I don't think there's some statewide version. I think every agency
Has their own, right? So
yeah.
So this may be something, Chelsea, that we need to just figure out agency by agency. Like, we may just need to have a little bit of a narrative here about the decision-making process, or the, you know, the DUA. There may be a handbook or some other kind of agency by agency guidelines for data use sharing that we may be able to hunt down here. Which I think is really strongly connected to the next section, which is really where are there existing statutory limitations, requirements, or guidelines around data. So, you know, where, and I think there are some statutory or sections of the family code that may require data sharing about some specific project or between agencies around a specific purpose. And there are other places where our statute or our family code may limit, for whatever reason, data sharing between agencies. And we just don't now have a clear, comprehensive picture of where that is. And this may also be something that we're going to have to explore agency by agency.
I think a good place to start might be looking at those DUAs from each agency, because I believe a lot of statutes are cited in those.
That's a good idea, Travis. So that may be something that we can just reach out to the state agency representatives either on this work group or on our general TELC board and ask for some support to access those forms and to see if there's anyone's, like any specific kind of roundup agency by agency of those statutory requirements that we could get our hands on and include in this roadmap.
And they're long. They're like 15, 20-page addendums to the contract. So
Fun.
yeah.
Have fun with that. As the advocate on the group, I also want to again just reiterate that other states are doing data sharing agreement. So it will be very interesting to see where we get a no or we can't do that, when we can look at other states across the country that are doing that, and where like we all know the law can be
You
interpreted.
know, Texas is its own thing.
I know.
It doesn't always matter.
It
If
can be done.
another
We
state
shared
has
data
done
with
it
civil
their
agents.
way, we're gonna do it our way.
I know. So,
But
like,
we may be able to steal some language from other
states,
places,
right?
just as options or to,
Right.
as, you know, some possible paths forward if our
Right, or, like,
statute. But knowing how our statute might limit or support this kind of data integration, I think might be helpful for us to include in the roadmap.
Yeah, it'd be also very helpful for us to know from the outside, so that way we can also know, like, oh, let's provide this example of this state and how they got around that or how they solved that problem. So it'd be
Well, and
that'd be
quite
very
frankly, if there are statutory changes needed in order for us to make some of this happen, that is also helpful to know.
Yeah, exactly. Yeah.
Okay, great. So Chelsea, it seems like this may be something that we're going to need to follow up individually offline with members of this group and with agency representation on our TELC to see if we can get the agency by we may just need to break this down agency by agency. And then the last one is really around budget supports. So this was really identifying state and federal funding that has supported this kind of data integration or data sharing, and if there were any philanthropic grants that have supported this kind of data integration and data sharing that we knew of in motion right now or in the recent past. So these were the ones that Chelsea and Megan sort of dug up, but if there were ones that we wanted to add to this list, I think it would be helpful.
It doesn't come through the state, but is there and Megan, is there anything within the Head Start system for data sharing? I don't know. I'm just
Are you thinking on the prior, like not the philanthropic? You're thinking on
right, the prior one, right?
So it's all it sits at ACF, like it's at the federal level.
Mhm. But is there any
Security-
requirements within Head Start to share data or not share data? Is there any restrictions or April, you might know, restrictions or encouragements?
I think
don't
that's a good question for Alpharma, probably.
I think we should ask Alpharma. I think she could speak to that. I don't know how far back I can't tell if some of these these aren't all current.
No, some of them are recent, but maybe not current.
it may be too old to include, but the original sort of Texas On Track system, TOTS, to the extent that I saw it listed as one of the kind of inputs that was federally funded.
Do you
And
know
it's-
how like federally funded through what?
I think it was that was back with all of the American reinvestment. I'm trying to think. It was pre-ARPA. It was,
It was like Obama stimulus money.
yes.
Yeah,
I think it was Obama.
ARA.
ARA, okay.
ARA funded,
Yeah.
right? Yeah.
I mean,
It
I
was so
could
long
find-
ago.
Yeah, but that was the grant that established the Texas Early Learning Council and one of the studies and deliverables.
If we can
from that
follow the
council.
path back to what the name of that
Yeah, I can find
grant
it.
or something was, then I say, sure, let's include it.
Yeah.
Might as
Okay,
well.
I'll find it and share.
Thanks. Well, now you guys have this in your hands, so I would ask that you guys take a look at it and maybe bring it back to your teams and see if there's anything that we missed. And then please feel free to shoot me or Megan or Chelsea or all of us an email with any comments. We'd like to bring a draft version of this to our next meeting, like a more fleshed out version. So between now and then, I think we'll be trying to add the narrative that we talked about in terms of explaining a little bit about what each of these things is and was and did. And then sort of help use it as context setting for the recommendations along with the feedback that we're gathering. Megan or Chelsea, any other comments or anything else that we need to talk about this roadmap draft?
No, just want to tip my hat to Chelsea for getting it started. It is kind of exciting to see it starting to come together.
It is exciting. Megan, any public comments?
I have a question
Yes.
if there's no public comments. So PD
Megan shaking her head.
no
No,
questions.
that is
I don't get to ask.
Not shaking my head at Kim, just we received no requests for public comment, but I think everyone I saw who's an attendee probably knows how to make public comment in the future. If not, you know, you're always welcome to just send me an email the night before the meeting.
So my question is about the new PDG opportunity, knowing that that application is due faster than what this process will be complete, but also knowing that that's a great opportunity to potentially fund this work. So how are we merging those two or thinking about those two or talking about those two in the application?
I think we are thinking about those things in the application. I mean, I'm not the writer or owner of the application, but I do know that it is come up often as we talk about the potential for that PDG application.
Yeah, again, I'm just thinking like we won't have the full roadmap complete by the time the application is due. So how do we, I guess that's up to Kathy and TWC to figure out the wording around that. But it just seems like those two could be married.
Yeah,
Timing's just
I
a
totally
few months
agree.
off.
It's a great opportunity. So I think we will want to try to take advantage, but you're right, the timing doesn't quite match up
Right.
exactly. So some of it will be a bit of a placeholder, I think. I don't know, Megan, if there's
Yeah.
anything else that you want to say
I
about
was
that.
looking, one, I think Allison's still on too. I don't know if Allison wants to say something. But
Megan,
if not,
feel free to speak to it. I'm in my car, so.
okay. Couldn't tell if you were off mute or, yeah, no, ditto to everything Sarah said. I think it's an opportunity we don't want to miss. It's also, quite frankly, less of a focus in this grant than it was in the 2019 grant, but that doesn't mean that there isn't a place for it, especially given all of the great momentum and work that we have around it. So it'll just be, I think, partly a matter of using all of the work we do have so far to sketch it out and like placeholder it in as best we can.
Yeah, I mean, we sort of have to balance what they're asking us to focus on with what,
Right.
so.
But in order to serve more families, we need the data systems to be able to do that, you know. I can make that argument. So
All right, so here are our dates and next steps for our roadmap work group. So before we will come together as a work group, the Texas Early Learning Council is meeting on October 21st. I assume that we will give an update about what we've done so far, some version of what we've just talked about here. And then we'll meet together again on the 28th. And then at that point, we'll be able to dive more deeply into the survey results and the finding and the sort of curated trends and feedback from our stakeholder meetings. We'll finalize the second survey that's going to go out, and then dive back into the roadmap sections. So look at the fleshed out version of what we've talked about now, and then the additional stuff that we'll be working on between now and then. In early November, the second stakeholder survey will go out. We'll come back together at the end of November, talk about those second survey results, and walk through the sort of additional roadmap sections. At that point, I think we'll be starting to talk about recommendations and how we're breaking things up into phases. We have December 20th, which I know is kind of a delicate time on our calendars if needed, if we don't have everything tied up in a pretty bow by the end of November, because we've committed to providing our roadmap to the Texas Early Learning Council members at the meeting in January. So that's sort of where we are timeline wise. It's tight, but we're on schedule right now. I feel like that November 29th meeting is going to be a doozy. So just in terms of really being able to look at all the information and looking at the roadmap draft and really finalizing or trying to finalize our phases and recommendations back to the Early Learning Council. So if it's not already on your calendars, please circle it in red ink and reserve that time for us together. And then I think, I mean, Kim already, I was like looking at my notes to see what I've missed. And I think one of the things that I missed was talking about the new round of preschool development grant birth to 5 funding, which Kim already raised. But you know, just to acknowledge that it will include some support for this ESIDS development. And the Chelsea, yes, great. I was thinking that we were going to talk about the 3SI data landscape work. Chelsea or Megan, are you guys prepared to give a quick overview about what this is and how it is connected? Or am I doing that?
I can give Megan, do you want to go or?
Go for it and I'll pile on.
Okay, perfect. So yeah, so today, this morning, the 3SI data landscape, which is being funded by the Gates Foundation, was accepted by the Texas Workforce Commission as a donation. So they will be working with our agencies that provide early childhood programs and services to create a data landscape for us. So they will be asking agencies for documentation like data dictionaries and entity relationship diagrams that they'll use to create a high level map of existing data systems and documentation on common identifiers across systems. And the landscape is meant to be a companion to the roadmap, and it will go deeper into the actual data and data systems that could be included in an ESID. So it's great timing and will be a really great complement to the work that you all are doing. And I will just say we will plan to share a more comprehensive update and more information in the October meeting, but wanted to give you a heads up since it was officially approved today.
Whoop, whoop.
Yeah, ECI's met with those guys a couple times already, so they're,
Great.
I just want to say we're again, a tip of the hat to Chelsea for helping to navigate this process through. It's one thing to have a outside funder who's excited to fund something. It's another thing for us to like run it through all the right processes at our state agencies. And so we're really excited because it's going to complement the work really well, particularly for this work group.
I think it's really cool. And certainly we wouldn't have the bandwidth to do this level of work otherwise. So I'm really appreciative and looking forward to seeing what they pull together. Okay, that I think is our last slide. So any other questions, feedback, concerns? Then I think our next steps are to again dive into all the survey and stakeholder feedback that we've just gotten and figure out how to package it and share it back out with us. And then we'll be following up with folks individually and with individual state agencies around trying to finish filling in some of the gaps in the lists of things that we've just talked about, especially around statutory and governance structure, so that we can have a more complete draft when we come back together next time. All right, well, 4:40 then, 20 minutes back. And we really appreciate all your time. And for those of you guys who led and facilitated those stakeholder listening sessions, I thought they really provided a lot of rich conversation, and I really appreciate you guys both offering to do that, or at least agreeing to do it, even if you didn't offer. So I really think that's going to help us build a stronger roadmap and set of recommendations. All right. Thanks you guys so much.
Thank you all.
Thank you.
Bye.